Sticking with business development and also localization, pleased to welcome Til Jolly from Columbus Partners. Til, your corridor includes DC, but it goes south, doesn't it, to Atlanta and Charleston?
Yeah, that's correct. And thanks for the time. Great group. I'm physically in the DC area, probably not too far from Bob, and know it well. I'm an emergency physician practicing here locally. Have spent time in government, because everybody probably works for the government at least once when you live here. And in a large technology and telemedicine company as chief medical officer. Our firm is Columbus Street Partners. While I'm in the DC area, we really focus a lot on Georgia, South Carolina. Our partners are there. We have a large presence in Charleston and lots of connections in Charleston. And it's sort of interestingly called sometimes the Silicon Valley of the South. That may be a little overstated, but there's really lots of development, lots of growth in Charleston and Georgia. And both states are very supportive of new innovation. Great discussion from the partners on this call about Phoenix and Minneapolis and other places where we have experience in one way or another, and those states and areas are also good. You've seen multiple international companies developing manufacturing operations and other things for years in South Carolina and Georgia, because of their friendly business environments, the workforce, the climate, lots of things, and the presence of major academic centers, in and around the Atlanta area, in and around the Charleston area, and up into Columbia and Greenville, South Carolina, and other areas. So very important. Similar to other states, those states have state economic development authorities, as do most states these days. And really having a local presence and sometimes even a locally named entity can help in accessing those economic development resources. I know that's true in Virginia, and it's certainly true in South Carolina and Georgia, and probably other states also. We are looking at a number of interesting partnerships of UK and European entities. One of our other partners is in Israel, which also presents interesting technology and growth companies that want to come both into Europe and into the US, and are working across a number of those. As a physician, I tend to focus on the patient and the bedside and some public health issues. One area that's been very interesting for us, there are lots of areas that are interesting, but one area is the area we haven't talked about really today, which is pain management. We've looked at a number of, one can call them alternative strategies, but they're really strategies that work in an area that chronic pain actually affects, according to the CDC, 20% of the U.S. population, which is over 50 million people. Major problem. We all know about narcotics and other issues with that, but things like music or things like foods or plant-based therapies or other things. And we're working currently with a music-based partner, and looking at using that as an alternative therapy for pain. Lots of data on this. We like to look at science. And it's nice when science supports what you want to do from a business standpoint. So we are really looking at that sort of thing. Yes, we have a focus in Georgia and South Carolina and also in the DC area, and really take to heart what others on the call have talked about related to the legal and regulatory aspects, which are very important to consider and pre-plan as one is going into these sorts of ventures. And we're very pleased to be working with GTM on these sessions and discussing these important matters. There are lots of innovative companies around the globe, both UK, Europe, and otherwise. And all the statistics you heard earlier on about the size of the US market, the money put into the US market, the growth and the need are true. And they really speak to the need to have technology and health innovations helping all of us, and potentially going beyond the US once it's proven in the US, going into other areas, Australia, Canada, and otherwise. So that's really just a brief summary of what we do, and would love to engage with any of you further.
Until you also, from a conversation I had with you and Michael, you look beyond sort of life sciences as well, don't you, into other sectors and other areas given in the region?
Yeah, that's very true. The technology and health interact in multiple ways, and then purely technology and other innovations that may enter the marketplace are areas we look at. We have, our team is not just health focused, but it also includes attorney, business development, and then other consultants in our network who focus on other technologies and development that can be brought into the U.S., into certain regional areas, and grow. So and the interaction among those technologies is important.